The Big Apple now constitutes 30% of all cases in the United States, and while residents have been urged to shelter in place, the state's governor has not formally imposed the rule, with dire warnings from the city that it was not getting what was needed from the federal government as medical supplies dwindle.
Here are the supplies that must be provided to New York City early in April for us to ensure that our healthcare system, public and private, can bear the brunt of the coronavirus crisis and serve our people. We need 3 million N95 masks. We need 50 million surgical masks. We need 15,000 ventilators. And 25 million each of the following items of personal protective equipment, which our healthcare workers and first responders would use depending on the situation. Surgical gowns, coveralls, gloves, face masks. We need these in great numbers.
He's called for the army to be deployed to increase healthcare capacity and beds in the city, while on the West Coast, in the country's most populous state, California, a statewide stay-at-home order is now in place.
The virus will impact about 56% of us. You do the math in the state of California, that's a particularly large number. That number in and of itself shouldn't be overly alarming. The vast majority of us, the overwhelming majority of us, won't have symptoms, will be perfectly fine.
That's about 25 million people who could get infected in one state alone, as the federal government's drug administration now moves to test new therapies in the absence of a vaccine that is still at least 12 months away.
In the short term, we're looking at drugs that are already approved for other indications. So they're already approved, as the president said, for other diseases. As an example, many Americans have read studies and heard media reports about this drug chloroquine, which is an anti-malarial drug. It's already approved, as the president said, for the treatment of malaria as well as an arthritis condition. That's a drug that the president has directed us to take a closer look at as to whether an expanded use approach to that could be done to actually see if that benefits patients.
More broadly, the UN chief warned that a global recession was a near certainty and that current national responses to the coronavirus pandemic would not address the global scale and complexity of the crisis, particularly in vulnerable regions of the world.
Our teams in Africa are working very hard with the governments to support them, but my very strong appeal to the G20 is to have a particular concern with African countries and other countries in the developing world. We must absolutely be strong in supporting them, because the virus is coming to them, and their health systems are extremely weak. So they need a very strong support from the developed world. And if that support is denied, we could have catastrophic consequences. If the virus is not contained because countries have not the capacity to contain it, it can spread like wildfire, as I mentioned, and we could have, even with low rates of mortality, we could have millions of people dying, and this is absolutely unacceptable.
As the global caseload reaches 250,000 with more than 10,000 dead, the United States likely to exceed 200 deaths today. Sherwin Briceby's SABC News, New York.